Hi guys, I'm Melina, and for 23 years, I literally can't believe I'm saying that, I've been helping women get unstuck and feel healthy, fit, and confident in their own skin. This is the Melina Method podcast, where nutrition meets mindset, fitness gets unraveled to be your superpower, and we really dive in to see the real you for who you are. Hi, you guys. Little different outfit today. Welcome back. I tried to match my guest to be not in fitness clothes for once. No, welcome back to the Melina Method. I'm super excited to be here with a friend, gym friend, new friend, in my life friend, and also just a huge medical professional that I can't wait to kind of dive into this topic that we have today. We're talking about the new standard of healthcare and medical care, or private healthcare, I should say, right? Private healthcare. Yeah. This is Reem Sanadiki. I'm very happy that she's here, and she is here from Prestige Concierge Hospital. And the kind of theme for this episode, if you will, is discretion, access, excellence, and I have some keynotes here, little notes here, and some questions that I'm going to obviously be diving in. So if you see me looking over, that's what I'm doing for those of you watching, not just listening in. But really want to kind of get into why high-level personalized healthcare is becoming the future, and especially here in Las Vegas, because we are in Las Vegas. But so we're just going to kind of dive into it. So, Reem, I want you to just kind of introduce yourself, what inspired Prestige Health Concierge, and why this is maybe talk about the gap and kind of what's happening between regular healthcare and concierge healthcare.
Okay.
Your background.
My background.
Verse.
Now it's my turn.
Yeah.
Okay, let me introduce myself.
Yeah.
You say my name, Reem, right?
Yes.
Correctly. A lot of people, it's just Reem.
Yeah.
I grew up in Dubai.
Mm-hmm.
I married my husband. We moved to, he was already in Chicago. He was a doctor. He was doing his residency there and fellowship. And healthcare and, West Side is just a totally different level. We moved to Vegas for for work. We moved to Vegas. Can you hear me well?
Yeah, I'm just going to move this up just in case.
What, 23 years ago or 24 years ago? So it's been a journey. And healthcare at that time was just shocking for us from every other
Dubai?
person.
Or just in general?
No,
From Dubai to here?
For me, I was a pharmacist.
You were a pharmacist.
I was
okay.
a pharmacist.
That's your background.
Yeah, my background is a pharmacist. No, I'm not from Dubai. I'm from Chicago, Michigan. So these areas,
Right.
where healthcare, it is totally higher end.
Higher end.
You
Got
know,
it.
all these schools and all the research, you have
Yeah.
a whole entity of healthcare, not healthcare facility.
High end.
High end.
Yeah.
So we came here. Vegas, you consider as rural,
Rural,
Yeah, we're just and it's a small city.
A little behind.
A little
maybe.
bit, yeah,
Okay.
way behind.
In their systems. Or
And their
something.
system or healthcare or even amount of hospital we have. So, long story short, Vegas grew and healthcare grew.
Great.
It's just we are now much more advanced. We have great doctors. We have great teams. People here are staying, not just transit. They used to come for a couple of years.
And
they
leave.
like the
More
now,
people are staying.
No, more people stay. It's more like a family oriented now. You have schools. Of course, we need more and more.
Yeah.
You have more we have before Valley Health and Desert Spring. We have only few hospitals, but now we have
How many hospitals are in here in Vegas now? Do you know?
No.
No.
But there are a lot.
There's a lot now,
all
yeah.
over the valley.
Yeah.
Although still so we want to change. The idea was changing the idea of, okay, if I want a good health or take care of myself, the best way to go is whatever you used to say McCarran Airport, which is
Right.
Harry Reid Airport.
Right. Harry Reid.
Before. So, and I honestly, I was just that's not right. I know my husband, and I know a lot of good doctors. We had a great team, and it's very elective, very professional, very knowledgeable, and they care about patients. So why people would travel and take the hassle of traveling, flight, going to the uncertain just to check their health? But we have a great facilities here. We have a great great doctors, great team,
Sure.
great lab. Why we need to go?
Yeah, because you're like, we're staying here. What more people need to know about us?
Yeah,
Yeah, like it just
and
needs
just
to
like
be known.
in our community, like everybody call. Okay, we are going admitted to the hospital. We need this and this and that. I have these symptoms. He admit them to the hospital. He takes care of them from, the minute they get admitted to the hospital. That's what we do it in a daily basis. The minute it's like he treated them as a personal friend.
Personal friend, yeah.
Like from
That's
the minute
his care. That's his personality.
Personality from the minute he comes in to
Right.
the minute they leave. So he follow up with lab work, with their doctors, with their primary, with their discharge notes, with every single details.
Right.
So I was like, I always tell him. And then plus when you have a VIP, somebody call, okay.
So there is VIPs in regular healthcare, or kind of, or what is it like?
Hidden.
Hidden.
It's like who you know.
Yeah, sure.
Like people a lot of people, they're like healthcare is just very private, or
Sure.
especially if they're celebrity or they are one of the executive.
Somebody,
They don't want to be
government people.
government
Yeah.
people. They don't want people to see them in the hallway
No.
of the
Hospital.
hospital.
Yeah.
So it's like any other concept in life. Like
Right.
you have VIP lounges for VIP lounges for airport.
Sure.
You have private jets, right?
Yeah.
You go just like I don't want to be with. It's not something people will like because their position.
So
they
what-
need to be more like privately.
Do you think in general, like forget Vegas, in general, is this concept growing? Or you don't know?
No,
or
concierge
Concierge.
concierge for sure. It's like even in Vegas, I still remember when they start talking about concierge as a internal medicine, one of clinics. You know that there are a lot of concierge clinics.
Okay.
They have
don't tell everybody.
Yeah, we have a lot nowadays. I don't know.
Is it a Vegas thing, or you think it's happening
No,
everywhere?
it's happening everywhere because it's
Okay.
more like the healthcare system is overwhelmed.
So, question.
Okay.
So, because I moved to Vegas, I needed to get health insurance. I know this isn't about insurance, but I had to go to a broker.
Yeah, for sure.
That's how it works here. Like California doesn't work like that.
Because you have major one. I'm not sure about California, but I know they have big hospital. They have their own
No,
insurance.
but that's not how.
How it's California?
No,
I'm not sure.
I don't know. I just got private insurance. You just have to call. You have to call around. I don't know. I didn't have a broker, but here it's like you work through the agent, and I love my agent.
Honestly, it's much easier.
Much easier.
It's more like to facilitate your life. To make things easier for you.
Oh my God, she's amazing.
It's like
she helps me find doctors. I feel like honestly lost with her. She renews my stuff for me. She, when I added my children, because I moved here, I was pregnant, and I was like, oh my gosh, I'm pregnant. I have to find healthcare. Is that going to be hard?
And there's a lot of curves in the healthcare. There's
Right.
a lot of what do you want? Whatever 30. There's a lot of insurance wise. There's a lot of ways to figure out what fits you because each family is different. Right?
And then I was adding my kids, and then finding doctors.
So this is
Anyway.
also an extra service,
Okay.
right? It was added. There will always be broker, but now broker is very popular. Everybody goes to a broker, healthcare insurance broker,
Yes.
to choose which insurance fit his budget.
Yeah.
Which
their family.
their family, and they change yearly, right?
Right.
They
can,
assess
yeah.
you.
They do.
Same thing about doctors. Before you used to go you want to go to concierge doctor. Before you want to go to, it's like an access. I wanted to go which internal medicine I should go or a family doctor for my family. Which
So who helps you find that?
Who? Well, that's the thing.
Who help? Your primary is supposed
Your
to help
primary
you.
help you, which is okay, who should I go to OBGYN,
Yeah, who should I-
cardiologist? They referral. It went through based on referral. Your
Right,
primary
right.
refer you to that. But again, when you need 3 months, 4 months, 6 months to get
in.
access.
Yeah.
So again, since we've been here in this city for the longest,
How long have we been in the city?
24 years.
Okay.
and in the medical field, and just like he is the ICU directors of many Valley Hospital. Now he's in the ICU director of West Henderson and Henderson Hospital.
And Henderson, both.
Both.
Okay.
So he knows a lot of, like, he worked with a lot of doctors.
So this inspired you to create this.
Yeah, inspired us, like access to.
You're like, we need to launch something that we can really help people.
Have access. This is one path. The other path is, okay, I need to do procedure. Oh, I have to call the primary, ask me to go to my cardiologist to clear clear. I need to go to do X-ray. I need to do lab work. I need to do all that. It will take you, if you're lucky, 2 months to clear for a procedure. It will happen in 6 months because everything is packed.
I had a friend, she had breast cancer and was in remission, but like she found some lumps and she needed to go get these lumps checked and she couldn't get in for like 2 months. And I was like, I would have anxiety. Like, I need to get these lumps checked.
That's another factor why we choose Prestige, why we did Prestige or with the project behind it. My friends happened the same thing, and it was just like, but she was overseas, and her insurance, because also overseas in Europe, it's more like
they don't have insurance.
They don't have they have insurance.
Well, but I know, but you get free health care there.
And that's it.
Yeah.
But when she wants to see her doctors, it will take her like 6 months. She call her private doctor or whatever they call it, private hospital.
Yeah, they call it private. And
here
Greece
we call it concierge.
Mm-hmm.
She's like, I want to check it. He's like, come into the hospital. Let's do that. And just in a minute, like they did the test. The result came back. Pathology came back on. It was Saturday.
So obviously,
it's access.
It's access. And obviously, there's fees attached, right? Like,
of course.
Right.
And also, it depends. There's a membership. Why the membership? The membership is for you to know that, okay, whenever I can go to the hospital, this is different than the field the concierge doctors, your concierge doctors will give you.
Right.
It's a hospital base. Whenever I'm going to the hospital, you don't know usually whom you're going to see.
No, you don't.
You don't know. Like, if I'm going, like, to see, like, in any emergency case or any, like, when you call your primary doctors, it's like, okay, you have to go to the hospital now. You will go, you sit in ER for what, 2 hours? Then they take you, they put you, maybe they're overwhelmed.
It depends. They take people in order of severity.
Of course they will. And then, like, but still, like, till the doctors, your doctor or like the ER doctors come. And they're great doctors again, but he is overwhelmed with the amount of people in ER. So then they will take you to if you're admitted, they will take you to the room. If you're admitted to the ICU, so it's a system.
It's a system for sure.
So we are just trying. We will provide you with somebody, help you with that system, and bypass. It's just like not bypass. It just access.
Right.
Access.
So the vision,
facilitate access.
Concierge medicine is obviously growing. So the vision is access. The vision is bridging the gap between regular healthcare.
Exactly. And that concierge doctor will come to you and will take you through your path in the hospital. And he is the one so you know him, you know the doctor, he knows we have a file of your record. Sure. So it's not like, what medication you're taking, you already know. You already know, especially
your personalized health with your concierge. You get personalized health care. You get your private physician access. You get a high-touch patient experience.
And you'll have your own suite.
You have your own suite. There's also the coordination of specialists like that. And then you get this luxury experience.
A luxury experience.
So, and obviously that's way different than standard. We don't even need to discuss. We honestly know that based on everything else we just talked about. Why? So, do you
it's
feel...
like time consuming. Other than that, this is like, you save your time.
Save your time.
Save your time and save certainly.
More and more people are seeking this?
Okay, for sure. Whoever we talk to, whoever we approach, it's a new
how long
concept.
has it been around? Yeah, no, you guys just launched it.
We just launched it.
I know.
We've been working on it with all I think the idea came 3 years ago.
3 years ago, okay.
And we've been working on it like a lot
with your group,
people, with the of course with lawyers, insurance, everything.
No, but I mean like with your team, like getting your team together.
For sure.
Yeah.
And then everything is just like set ready, and we're ready to go. So that's why now we're doing more events and more like, it's more like health awareness. Anything new, and especially in healthcare, people are like, oh, wow, what's that?
Yeah.
And for me, it's like concierge. I still remember when one of our friends, he said, like, I'm opening a concierge. I was just like, it's very risky because, there's something that's just like, oh, wow, that's a very good idea. It's happening somewhere else, but
It
we
is.
don't have it here.
Yeah.
And then, but concierge hospital, for sure, no one have it.
Right. In
No one.
Vegas.
I'm not sure.
There's clinics, but we don't know, like,
clinics,
hospital.
what hospital is.
So-
but for hospital-wise, no.
What are you? Is it a new hospital building, or are you using the Henderson Hospital?
No,
How does that work?
We have access to private suites.
Okay, that's what they did. Okay,
we
cool.
have access to private
We
suites.
understand that, like, discretion is obviously a big part of luxury healthcare, and we understand now, like, kind of like what access means. But how this is something that we kind of talked about. You wanted to really get into, like, how walk us through, create an experience the moment someone creates their membership. Like, what create an experience for me. Paint a picture of what someone would experience being with Prestige.
Prestige.
Yes.
As I said before, the access, the facility, the access, all the, like, the level of care you're gonna be taken care of is just like beyond.
Right.
And that's how it's Prestige for. Plus now, just like since we're talking, we launched a new one-time service.
Okay.
Instead of people having to have a membership, a lot like one-time service. We notice a lot of people. It's included in the membership, but now we're like doing, and I will explain it more. One-time service as a executive health assessment.
Okay.
Or you call it executive. We call it VIP health screening assessment.
I love that. Okay.
So
everybody wants to be a VIP.
VIP. So we do it at some people go like to different kind of Mayo Clinic, Cleveland Clinic to do health assessment.
Yeah, Mayo Clinic.
They do like blood work, they do MRI, they do X-rays.
Yeah.
They do like whatever you're like, the doctors assist what you need. Mm-hmm. And then he will order lab. And you on the spot in the facility, you'll do all that, or order lab or order services, and you will on that facility will be done. You'll do all that on 2 days.
2 days.
Now we offer it here.
Okay.
We offer it through Prestige Health.
Right.
Also, Prestige Hospital. One day you come in.
Walk me through it.
Okay,
I'm a client. I'm a patient.
You come. First of all, we just send you an invitation because we have to
get an invitation.
We assist how.
Love.
Because, again, we don't want to overwhelm the system.
Okay.
It needs to be exclusive. So it's not a membership, but it needs to be also. It's like an access.
This is a one-time service. This isn't a membership.
This isn't a membership.
Okay.
This is part of the membership. So
it is. So if you're a member, you get it.
You get it.
Okay.
You get it. But now we offer it for part of one of
a service. If somebody wants to test the waters, maybe.
Yeah. As you now, we're all talking about longevity. We're like, people are doing all these like
everything peptides. We know,
like lab work,
lab work.
How many like
different
you don't hear, you don't
everything.
even know about these like lab work. So it's like, what are you testing for?
Yeah.
So now people are caring about that. You don't want to. They don't
really
wanna
get them dialed in.
Yeah, and they don't want the surprises. Like okay. They go in. My husband will, with his team, will take you in. He will kind of admit you, but not like take you to the private suite, take you and go to do
Is this
MRI.
the one where you get picked up or no?
This is the picked up is private, is part of the membership.
Okay, got it.
But this one is just like
so you go to your facility.
You go to it's in Henderson Hospital. You go to Henderson Hospital. They take my husband and his team, Dr. Oliver.
Greets you.
He will take you in. And he already assessed what you need.
Okay.
Do everything in one day. You go back home within few hours.
You have everything.
And then next day you will get everything ready.
They will
have either a meeting with him, like consultation, then it was just like, then he will put you on a path.
And yeah, because this will help. He'll guide you in like
A path.
longevity,
Yeah, I was
hormones,
just like,
recovery.
okay, you need to work, like, because he will treat you as, that's what we've been treating patients.
It's like a wellness approach too, right?
Yeah,
like
you are not,
yeah.
okay. It's like other fields are just like cardiologist is the cardiologist, intense is the pulmonologist. He treats you as a one. Your body is one body. You know, it's all connected.
Pretty much like integrating your whole like lifestyle with your health.
And then that he will send you a path, and he will help you with access to all specialists.
For sure. I mean, I personally feel like being in the health and fitness side of things, like being in this stage of my career, I want to say, because my career has gone through so many phases, and now I'm in my 40s. Every client I work with just is way into prevention, anti-aging, longevity.
Yeah, just like...
Especially a lot of the women I work with. I mean, I would say like 85% of my clients.
We used to wait till somebody has a heart attack. Oh, he has a heart issue. Oh, he has
or you're in menopause. You
now,
don't get your cycle anymore. I mean, let's be honest, right?
Now we're change. Healthcare change, and we need to change.
And proactive wellness is important. Women are advocating more and more for their health. I feel like every client I've talked to, it's like, and I have clients all over the country, so I'm not even talking about Vegas. So I'm talking about outside of here. Clients will be like, oh, my doctor just tells me I'm in perimenopause. And I'm like, what? Like, no, like, we got to fix this. Like, let's get your labs. And there were clinics like that I was working with outside of the state, hormone clinics and stuff that I would send my clients to because they were doing such a thorough job on labs and hormone health and what was really getting into what was wrong with them, and just changing their supplements and their diet. And I mean, that's where I come in as a nutritionist, sports and clinical nutritionist for 20 something years. And I was learning so much from this hormone clinic, and I got really passionate about it. And that's why I love like learning more about the medical side of things and connecting more with the medical side of things, because I feel like there is this gap that needs to be like bridge together, which I feel like you're doing, obviously on a higher end level of like wellness, longevity with medical, because we do need medical,
Because you just like, as for example, for wellness or whatever, even for fitness, you need the lab work, right?
You need it.
You need it. You cannot go on.
I tell all my clients
you cannot go.
Not everybody's like me, but I tell all my clients, we're going to get your labs done.
You cannot go on a base on like how person look. You need the lab work.
Yeah.
Like if he's, some
every
people.
Every 3 to 6 months.
Exactly. So that's a new trend.
It
for
is.
Everyone.
And all these companies are popping up where you do it at home.
I know.
Yeah.
And so people now are more aware of a lot of like health issue wise, not to preventive. Right. So that's why we have this yearly
hormones.
Especially like that's why you have a yearly checkup, and it's like we call it health assessment, and then you go from there.
So
and it's tailored to your needs. That's another thing. I just keep popping up. It's tailored to your needs.
Yeah.
That's like how it is. It's just, and in a full discreet, like no one would know.
So are you guys fully up and running?
Oh, yeah.
Oh, you are? Fully up and running.
Fully up. As I said, we've been doing that for like.
But backdooring or whatever.
Whatever. It's not like, okay, now we're just like, we have to figure out how to do this. This is, you can say up and running, but not in a system. And it doesn't have access to anyone. Like, only people who would know my husband really like.
Right, they would like message him,
and then, but okay, what about the rest? What about like the community? And we want to give back to the community. So that's part of like, we have all these casinos and hotels and everything. They're doing a lot to get clients, Why we don't want to get clients, but I mean, why we don't keep our people, like, instead of leaving, just oversee whatever to get the right healthcare. We have amazing doctors.
So do you feel like it's improving?
Consulting.
In general, like the whole...
Definitely.
Yeah.
Definitely, it's overwhelming.
I mean...
That's why we have a lot of, like, as you said, concierge medicine is now a thing, because it's overwhelming.
I mean, I definitely.
We don't have enough.
I'll give an example. Because it was hard to navigate healthcare here at first, but like, it is about who you know. Like, I mean, I got lucky with my son. He has asthma, like
You
baby
pick up.
baby
You
as
pick up and ask for who's a good doctor.
but
Right?
they sent me to Nakamura, and apparently like
He's the best.
he's the best, one of the best in the country,
Yeah, he's the best.
and people fly in to see him.
Yeah.
Which is how, like, I'm like, you know, Vegas has great doctors, and then dermatology. I have a very good friend who's a very successful Newport Beach dermatologist, skin surgeon, and he's like, oh my God, one of my like best friends who's one of the best dermatologists is in Henderson. Forget his name, but anyway, so like I have that dermatologist, and like so I feel like honestly, and I came from California, I like my doctors here better than any doctor I had in California
Because they are selective.
They were selective.
And you know,
Yeah.
and they want to be like, and they're like, they really care about my patient. For my,
Right.
like, I give you example. I can't say the name or details or
Sure,
anything.
that's okay.
But my yesterday, my husband was just like so proud of like he saved a young girl.
Yeah.
She has like delivery and has a complication, and it's just like for a minute they almost lost her. And you imagine, you know,
She gave birth.
she gave birth
Yeah.
and a lot of complication, and then he saved her life. As I said, why? Because he sees her as a whole system. Not
Yeah.
like, okay, you give birth or this. No, this has happened. He knows the scenario right away, seeing the lab. He has that much of experience.
Right.
So seeing the lab, seeing what's happened, seeing the case,
Yeah.
it was just like even her, like without even looking at the CT scan, whatever, just like,
Right.
okay, this is gonna happen. This is happening. Let's go in. The fast act. And that he saved her life. Actually, less than 48 hours, she's up and her heart stopped. After 48 hours, she's holding her baby and get discharged. Her heart
No
stopped
way.
for 20 minutes.
Her heart stopped.
For 20 minutes.
I have the chills.
Like when she gave birth. So when they called
How
him
that
for
happens.
code blue,
Yeah.
he was just like, then he's just took her to the ICU. Just like, it's that
She
for
was
him.
just in normal labor delivery, or she went to ER?
Normal. No. Normal labor delivery.
Wow.
It's like the complication happen in life, you know, like
yeah.
luck, your luck in health. But then at the right time, at the right moment, he was like, I'm just bragging about him. But
No,
that
of
was just
course,
like, I have to
brag.
brag. At the
Yeah.
right time, at the right moment, at the right hour, he was there. He saved her life. And literally less than 48 hours, she is up and running, holding her baby and leave. And it's just, she had the like, so he came yesterday, which is like, he was so proud. This is especially with young, you know, like when
Yeah,
I
young.
go, when I always like feel it, just like when somebody stopped me, oh, my husband saved my mom. Oh, you're my husband. Because it just like, patience for him is not a number, not like paper. Patience for him is a human.
Yeah,
With,
it's a
like,
human.
It's
Totally.
like he cares about you being alive.
will-
It's about the IC. That's how his.
I will say this about
field.
Henderson Hospital. I have one experience before I do a little quick fire before we close up the episode. But so my daughter is 4. She was 2.5 the first time she got croup, and my son was not even 2 months old. Okay, so I was postpartum, barely, like what, 2 months, 6 weeks, 2 months old, and no symptoms, no nothing all day. Woke up in the middle of the night, it was like someone was strangling her. Okay, this is croup. I don't know. I've never had toddlers before. I never knew what croup was. I was like, instead of going to the closest ER, which is stupid of me, but I went to Henderson Hospital because I'm like, she's probably gonna need to get admitted. You know what I mean? So I drove to Henderson Hospital, which is still the closest. That's the closest hospital, not the
mine.
closest ER. And she would. We literally just grabbed her from her crib at the time, and I was in like pajamas, and my mom happened to be there. Thank God with my baby. We rushed to Henderson Hospital. We did not wait. No, there was all kinds of people in that waiting room. We ran back there. They took us back right away in the ER, put her in a room, ripped off her clothes. I mean, she was like this the whole way in the car, peeing, throwing. I mean, it was bad. She was just, she could not breathe. It was such a bad. They immediately started care on her in the ER. They did a EpiPen. They did all. It didn't work. They were about to intubate her. I was like signing like so many things. And they were like, she was like, her eyes were rolling back. They were about to get the tube ready. They had to sign off on all this stuff. They were like, we're going to try this one more time. And then they did it again, and it worked. Did another EpiPen. And we did have to take her to get admitted, and they took us all the way over to Summerlin. Long story short, because this is take forever, but the staff there was amazing.
Yeah.
No, amazing.
Amazing.
And they said that, I forget the name of the doctor, because I would say his name. He said that was the worst case of croup he had been a doctor, he said, he's ever seen.
Yeah.
It was,
so bad.
he goes, you are very lucky. He goes, next time, don't you ever drive. You call 911. You call 911, and if this happens, don't ever get in the car and try to take her somewhere. So this happened again.
Yeah.
No, it happened 6 months ago.
But you know what to do now.
I know what to do now.
Yeah.
And Nakamura, because I go for it, gave us some stuff to do in case that happens again. And I know the cold air and the freezer, and but this is like so bad. She's like, she's gotten a really bad reaction.
Sometimes there's no way around it. There's sometimes the severity is just to the max.
Yeah, I mean, I didn't know because it's the only experience. Because the other people I know is like, oh yeah, like you get a barky cough, you go get your steroid. I'm like, go barky cough. She didn't even have a barky cough. She just woke up in the middle of the night, like it attacked her, and her whole it was so scary. It was so scary. She was like 2 years old. But anyway, that was my experience at Henderson Hospital, which was great.
Yeah.
But
no, they have like, oh my God, if you should see the suites, it's just like beautiful.
Yeah,
it's like living room, dining room, a big bathroom. Yeah.
I gave birth at Southern Hills Hospital, and I liked it.
No, they're like No, we have a lot of good hospital, but just like as a concierge,
you have to.
It's the only one that
can people
help us, to get that access.
I do have some quick spitfire questions where you're gonna ask them quick fire. They're called quick fire questions, and we'll wrap up. But do people get a tour? Like if they inquire, can they get a tour? Or how does this go? If they're thinking about becoming a member, do you do a meeting with them?
Oh yeah, of course.
Okay.
We're once you just you would submit inquiry, and then you do become a member, and then we meet with you. As I said, we have to assist you if you ask. Okay, I want to see what's the suites. Yeah, of course.
Okay,
for sure.
Cool.
Because you need to understand, especially who has no experience in hospital. Believe me, everybody has somehow a hospital experience. So they know.
Yeah. Okay, here's my questions. You're going to answer them short. Number 1, biggest healthcare misconception.
As we don't have good doctors.
Okay, I figured that was going to be. Okay, number 2, most overlooked wellness habit.
Well, I think it's going skipping the gym.
Oh, okay. Skipping the gym. I love that. What should women over 35 prioritize? Because that's my niche, right?
Themselves.
What specifically? Should they prioritize? Labs or something specific?
Maybe also prioritize their lab. Yeah, lab is
for their health.
For their health.
I feel things start to shift over 35. I don't know.
Yeah, 35 is early.
Still early.
Yes,
over 35. So what should they prioritize if they're over 35?
Honestly, the weight management for me for
there you
women
go.
Is just
for sure.
It's major.
Get your weight management dialed in. I feel after people have kids, they have kids and they never. It's hormone weight. It's not even real weight, but they let the hormone weight sit there and then it becomes real weight. It's anyway. That's a whole episode. We need to talk about it. Best daily wellness non-negotiable. What's something they should do daily, non-negotiable?
Move.
One thing everyone should test yearly.
Your folic acid, your iron.
Folic acid and iron.
Yeah.
Okay.
Your D3.
D3.
Your
major vitamin deficiency, mineral.
These may, and then your kidney and liver function.
Okay. And then if you were to say one thing about luxury healthcare and what it means and why people should look into it, what would that be?
Access and to being certain who you're gonna be with. Under under which hand.
They feel certain about it. I love that.
Yeah.
I mean, I think we talked about a lot of different things with the future of, healthcare, but I think the main thing is that it should be personalized, preventative, and that you have an actual relationship. It's a relationship. It needs to be more relationship driven, and that's exactly what you guys are offering, and that's awesome. And I feel like we need to have more conversations here. We can go through different topics, but I hope you guys got a really good idea of what concierge services in the medical space look like, and I'll make sure I drop in the show notes where to find Prestige Health Concierge. Even if you're coming into Vegas and you never know what you need, encourage you guys to really be more proactive about your health care and do some of the things, even if you're not in Las Vegas, that we talked about. And yeah, I think that's pretty much a good wrap here. Anything else you want to mention?
No. All good.
We'll put all your information in the show notes, and thank you so much for being here.
Thank
and
you
glad
for
we
your
got
time.
to
I'm glad to good chit chat.
I love chit-chatting with you. All right, you guys,
All right.
thank you so much. We'll see you next time. Thanks for tuning in to the Melina Method podcast. I hope you're fired up to make a shift in your life. That's the whole point. So if this episode spoke to you, subscribe to my weekly insider. It's melinafitness.com/subscribe. It's all the fun things that you want to get to know me and know what's coming up and what's the latest tea on the Melina Method. So I will see you guys next time.